Hello, I'm Dr. Elizabeth Zhang, and I am an ophthalmologist and oculoplastic surgeon. One of the questions that my patients often ask is, can my cataract come back after surgery? So the answer to that is no. Once you've had cataract surgery, the cataract is completely removed and a new intraocular lens is put in its place. The cataract can't come back. However, the signs or symptoms that you had of your vision becoming a little bit more blurred may come back due to something called a posterior capsular opacity. And sometimes people call this a secondary cataract, but it's really not a cataract at all. What happens during cataract surgery is imagine an M&M candy with chocolate surrounded by a candy shell. So the cataract is the chocolate inside, and there's a candy shell that it lies in. And so what we do is we break open the top of that candy shell and take out the chocolate, which is the cataract. But we leave that candy shell in place, and we actually put that new artificial lens in that candy shell. After cataract surgery, that candy shell, what we call the bag, the capsular bag, actually is clear, but it can become opaque, or some scar tissue can develop, or some cells can grow so that it becomes less clear and starts to block your vision. If this is the case, then this can actually be handled with a simple laser procedure called a YAG capsulotomy. And YAG is the type of laser used. The laser is completely painless, and it's actually quite easy for the patient. And so you just sit in a machine that looks very similar to a slit lamp, and we apply the laser to the scar tissue to essentially vaporize the scar tissue and make it go away. And then afterwards, your vision is clear again. The benefit, of course, is better vision. The risks are actually really minimal. So there is a chance that the eye pressure may go up higher afterwards. And so we do check the eye pressure after doing this laser procedure. Some people do have some inflammation. Some eye doctors will have all patients do some drops to treat the inflammation after the surgery. And some actually just wait to treat to see if there is inflammation, and then treat if there is inflammation, because not everyone has significant inflammation. In fact, I would say most people probably don't have significant inflammation after this laser procedure. So there is a somewhat theoretical risk of a retinal tear detachment, because you're like what we say tickling the vitreous. But I actually looked into finding some hard literature that actually suggested an increased prevalence of retinal detachments after a YAG laser, and I actually could not find anything that really substantiated that. So I think it's more of a theoretical risk than a real risk. And honestly, a lot of people who are having this laser procedure, they've already have what's called the vitreous detachment. So they're beyond really the risk of the vitreous pulling on the retina to cause a retinal tear. So it's really easy procedure, do painless. And if your vision is decreasing after cataract surgery, this may be the reason why. Of course, there are other reasons why your vision could decrease. And so you should go see your ophthalmologist in order to find out what's going on. If you like these videos, please subscribe to this YouTube channel so I can bring you more information about your eyes and your eye health. If you live in Northeast Ohio, at the time of recording this video, I am accepting new patients and would love to have you as my patient. You can find out more about me at www.dreyelid.com. Thank you.